Hello, and welcome to Focus on Hope. My name is Eve Moffat, and I'm the host. And our guest today is Richard Dehnert from Spectrum Healthcare. Hello, Richard.
Good morning, Eve. How are you?
I'm doing fine. Tell me a little bit about yourself.
About me?
Yeah.
I have lived here in the Verde Valley since 1979 when my wife and I moved here with our three small children to take over the radio station in Cottonwood, which in those days was called KVIO. And that was the AM radio station in Cottonwood, and we took that over and ran that for almost 20 years. We added KVRD FM, which is the country station. We built that one, and while we were at that, we raised four children, and they're all grown and gone, and now we're enjoying that empty nest syndrome.
You have that voice.
Yeah, well, thank you.
Well, how long have you been at Spectrum?
Went to work at Spectrum in 2002 in April. And so I have been there 12 years and started there working in the adult serious mental illness program, where I was what they call now a behavioral health technician. It was kind of an entry-level job in behavioral health, and it was fascinating, and I really enjoyed it, and I enjoyed working with the people. And after a while of that, the clinic's vocational rehabilitation specialist retired. And since I had been in business in the Verde Valley and I knew a lot of the employers, management thought I might be a good candidate for that job because it helps connect people with employment. And I enjoyed doing that for a number of years until the position of community relations coordinator was created. And again, because of my background in the broadcasting business in the community, I was appointed to that job, and I've been doing it ever since and really enjoying it.
Yes. What all does your job involve?
Well, things like this, going out and talking to the folks in the community, doing a little media work. I write some news releases for, I keep saying the clinic, and now it's, of course, Spectrum Healthcare. Write news releases. I represent Spectrum on the Arizona Council of Human Service Providers, which is a statewide trade organization for agencies that do the same sort of work that we do. I also serve on the Yavapai County Board of Health, and have some fun with the Rotary Club and just out in the community, making sure that we get the word out about Spectrum Healthcare and all that we're doing and all the changes we're going through.
Yes, a lot of changes.
Big changes recently, yes.
Yes. What was the reason? What's some of the reasons for the name change from Verde Valley Healthcare?
Well, Verde Valley Guidance Clinic was started back in 1965. A bunch of volunteers, or a small group of volunteers actually, got together and found a donated room in Cottonwood and started bringing in some mental health practitioners. As I recall, part of the story is that at one point they were bringing a psychiatrist up from Phoenix for half a day a week to provide services here in our community, and that was about it for behavioral health. And so it grew over the years, and now we have just recently changed our name from Verde Valley Guidance Clinic to Spectrum Healthcare because we feel that that is a better reflection of who we are and what we do. We now offer primary medical care to our clients and our patients. We have pharmacy services as well as our behavioral health services for both children and adults. And so it's bigger than a guidance clinic. It's more than that now.
How large is the staff?
At last count, I believe we had just over 130 employees. Yeah.
That's really grown.
It has grown. When I started there in 2002, I I think there were 45 employees, and now there are 130. But we have offices in Camp Verde and Sedona as well as Cottonwood, and now at the 2 locations in Cottonwood with the opening of our new building at 651 West Mingus Avenue. And so there's a lot of work to be done, and fortunately we have a great staff of people to do it.
Yeah.
There were over 2,500 people enrolled in our behavioral health services as of last week. As a matter of fact.
Okay. And the medical part is growing?
Primary care?
Yes.
Yes, as a matter of fact, it's pretty much at capacity last time I checked. And so we're able to provide primary medical care services to several thousand people above and beyond our behavioral health care services. But it's all part of one thing, really. It's not separate anymore. That's part of why we're doing what we're doing. Providing proper primary health care, medical care to people with mental illness and substance use disorders is really making a big difference in people's lives. It used to be that the two areas were sort of separate. You
Yes.
went to one doctor for one thing and another doctor for another, and they didn't really talk to each other. And our program is based around the idea of the integration of primary care and behavioral health, so that people get both of those services in one location, really, with our new facility. And it makes it easier for the primary care people to communicate with the behavioral health providers and vice versa. And so there's a better coordination of care and better outcomes overall.
Yeah, medication.
Medication is part of it, sure, yeah. But one of the things that we are doing with our primary care is to provide screenings for people to determine whether there may be some interconnected problems that affect each other. For instance, our primary care providers offer a screening called SBIRT, which is a brief intervention and referral to treatment program to determine whether substance use might be affecting a person's physical or mental health. And as part of an overall look at the whole person, rather than just a person with a physical illness or a mental illness, look at the whole person and look at all the things that are affecting their health.
Wow.
Does that make sense, I hope?
Yeah, in a way.
All right.
How does a person become a patient? What's the process for becoming a patient of
Sure.
Spectrum Healthcare?
Well, anyone can call our office and ask for an appointment with an intake person. And the intake people will help determine whether or not the person is eligible for services with us, because keep in mind that we are primarily the provider for Medicaid and Medicare. People who are eligible for access, which is what we call Medicaid in the state of Arizona,
Okay.
are a very large part of what we do, because they are entitled to services, and we're the people who are contracted with the state through the Regional Behavioral Health Authority, which is NARBA, to provide those services. And although we hopefully are going to be expanding to where we can provide services for anybody who wants them, there are still some limitations on eligibility for services at Spectrum Healthcare.
What is NARBA?
NARBA is the Northern Arizona Regional Behavioral Health Authority, and they are the managed care organization with whom the State Division of Behavioral Health Services has contracted to provide behavioral health services for that access eligible population in our area. And our area of responsibility is the Verde Valley and Sedona area. And so NARBA contracts with us and other providers around northern Arizona to do what we do, to provide these services under what's called, and I don't want to get too technical here, but the access program or the Medicaid program has historically had a carve-out, sort of a separate silo of funding for mental health and substance use disorders. And so that's called Title 19. And so we are the Title 19 providers of services in this area.
Okay.
We also, of course, have made an effort to expand to the general population. That's kind of coming in fits and starts, but we're working on it.
Yeah. Well, it fits and starts. What does that mean?
Well, there are very complicated funding formula for the different services that we provide. And in order for us to be able to cover our responsibility as the provider under that NARBA contract, we have some very strict guidelines on how the different areas of funding can be spent. It's a bit complicated, but just to make it a little bit simpler, there's a certain amount of funding that's provided to us for treating people with serious mental illness who are eligible for Medicaid, so they are under the SMI population on Title 19. Now, there's a lot of funding for that population, and yet there may be another population that doesn't fit that category, such as something that's called general mental health and substance abuse. Now, that population may be people who are having a mental health issue or a problem, but they don't reach the level, and there's a very strict standard for determining serious mental illness. They don't reach that level of serious mental illness. Well, there may not be as much funding for that population as there is for the other. So sometimes we find ourselves maybe a little bit overfunded in one area and underfunded in the other area. And it would be nice if we could just say, okay, we'll take that money and treat these people.
Yeah.
But unfortunately, that's not the way it works. So, it's always a balancing act to try to be able to cover the areas of responsibility that we have under our contract and yet be able to offer our services to the general public. And we're just kind of in the process now of figuring out how that works. Hopefully in a few years we'll be able to help everybody, and no matter what kind of insurance coverage they have, they'll be eligible for services. At this point, we're doing the best we can with what we have.
Yeah. Now you you also treat people with alcohol and drug addictions. Mm-hmm. Tell me about that program.
Well, our substance use and chemical dependency program is part of what we do, and again, depending on the availability of funding, different populations have different levels of entitlements on that. But we are the provider for, again, Title 19, that behavioral health carve-out. It also covers substance use and alcohol, all kinds of chemical dependency problems that people might have. So we have historically been able to offer substance use treatment for anyone who asked for it, but recent changes in funding have kind of forced us really now to limit it to, again, that access eligible population, the Title 19 access population or Medicaid. So that's where we're at right now. But those things change. We're always looking for ways to be able to serve more people.
Okay, your Spectrum Healthcare. I saw your business card, mm-hmm. and it says mind, body, all of you.
Sure.
What does that mean?
Well, again, it goes back to that integration of mental health and physical health, and rather than treat them separately, we treat them as one. So we're treating the mind, and we're treating the body, and we're treating all of you. So that's where the big U in Spectrum comes from. It's about the whole person. Rather than just treating a disease, we're looking for wellness, that sort of thing.
How does your job as public relations coordinator, mm-hmm. How's it affected you?
The name change?
Yeah.
Well, for one thing, I've spent a lot of time working on getting new letterhead and envelopes and that sort of thing. And I've written a lot of news releases, and we've done a lot of advertising on the local newspapers and on the radio to just let people know that Spectrum Healthcare is the new entity, the new name for what's almost a 50-year-old entity. The Verde Valley Guidance Clinic, as I said, got started in 1965, and over the years has evolved to much more than a guidance clinic. So that's why the name change was in order. But if you're the community relations person and in charge of communicating with the community, that's a tall order to be able to.
50 years is a long time.
Yeah, right.
Yeah.
And to make sure that people understand that we haven't been taken over by some big corporation. We are still the same local organization, same people, same board of directors. We have a wonderful volunteer board of directors who are really just the backbone of the organization, and they're still the same people, so even though we have a new name and really a whole new way of looking at the services that we provide, we're still Spectrum Healthcare.
Yeah.
Yeah.
What are 3 key points you want to bring out in this interview?
Well, one of them is, and pardon me for reaching for a handkerchief here, the rains are bringing out some blooms that are causing my allergies to give me a little trouble. One of the things I like about your program is the word hope. And so I was looking forward to discussing about how, hope as an important part of treating the mind and the body.
Yes. Please elaborate.
As I got into the mental health business, first, as I mentioned, as a behavioral health technician, and then later as a vocational rehabilitation coordinator, helping people find employment or training, or helping people identify what their strengths are, what skills they have, and what they might be able to do vocationally to improve their lives. And one of the things I found was that a little bit of encouragement goes a really long ways. And in some cases, people who developed mental illnesses or mental health disorders at a young age, maybe in their teens or in adolescence, sometimes were not encouraged to go out and do the things that other people did. They were kind of sheltered sometimes, and of course, in a loving way, but families had a tendency to try to protect their young people and really not challenge them, because they didn't know that people can recover from mental illness and that they can do the things that they want to do and be productive. And in many cases, we're talking about a functional recovery, and that treatment is part of that, but so is challenging oneself and getting out and doing stuff. So part of trying to help people with their vocational rehabilitation was trying to help them have hope that they could do things that they had been told maybe they couldn't do, or that it's worth a try. Let's give it a shot, and let's go out there and challenge ourselves, not to set anybody up for failure, but to work on strengths, to be able to identify those strengths and take advantage of them and move forward.
Yes. That's good.
Do you like that?
I like that.
Me too.
Yeah.
Me too.
What have you benefited from Spectrum Healthcare by working there?
Wow. Well, it's a second career for me. As I mentioned, I was in broadcasting for many years, over 20 years. And when my wife and I sold our radio stations, we kind of ran away with the circus for a few years and did a lot of traveling and enjoyed ourselves. But when it came back to time to figure out what we were going to do for the rest of our lives, I was really fortunate to become involved with the then Verde Valley Guidance Clinic and start working in this mental health field, because it's something I've really enjoyed, gotten a lot of satisfaction out of it. And Spectrum Healthcare, or Verde Valley Guidance Clinic formerly, is a good place to work. It's a really well-run organization. It's well-funded and managed, and so as an employee, I've found it very rewarding and it was a good fit for me.
Yeah.
Yeah. I should say too. Let me add to that um, it's provided an opportunity to do some, I think, important work. I've worked with people that their lives have changed. That's good.
Their lives have changed. Tell me some stories.
Well, it's tough to do that in a small town when we are so conscientious about confidentiality.
Oh, no names. Just tell me some.
Even circumstances
Yeah.
sometimes, can be familiar. So it would be difficult to be specific, but especially, and I think going back to that idea of hope, is that I've run into a number of people who, by working with them, and I certainly can't take credit for their progress, but been able to provide that sort of sense of hope that maybe nobody's ever told them before that they could do things that they want to do. Maybe people have tried to shelter folks from being in stressful situations or from being too difficult, being challenged, and sometimes we get together and say, this is about you. It's not about what everybody else thinks that you should or can do.
Wow. Yes, scary for a person who's been very scary.
So I've had people, later on, write to me or let me know that that message carried through and helped them a lot.
Yeah.
Yeah.
Yeah, you're providing
that's good.
hope. Yeah, you're providing hope.
Right.
Yeah, and this world needs more hope.
Absolutely.
Yeah.
I hope it rains, but it still hasn't at my house. It looks like you got some good rain in Camp Verde last night, but over in Clarkdale, we're still high and dry.
Yeah.
So I'm hoping for rain.
Yeah. Tell me about the new facility on Mingus.
Spectrum Healthcare purchased what was the surgical center there behind Maverick store on the 89A bypass in Cottonwood, and spent a lot of effort and time on reconfiguring the interior of it to fit our needs. And so now we are able to provide our psychiatric services and our primary care services and our pharmacy all there in one location.
Wow.
At 651 West Mingus Avenue.
Yes.
Yeah, it's really a terrific facility. By the way, we're going to have an open house there on October 9th.
October 9th.
October 9th from 3 to 6, and I hope you'll be there.
Wow. What do you plan to do?
Well, we want to introduce our facility and allow people to tour it and see what we have there, and then there'll have to be a little speech making, and we'll have lots of good food and some light hors d'oeuvres is what they call it, I guess, and show people around and let the community get familiar with what we've done there and just make everybody feel welcome.
Yes. Well, we just have a few minutes left. Is there anything else you'd like to talk about?
Congratulations on doing this television program. This is great. I like your topics and the things that you're talking about are inspirational. So thank you for inviting me here and keep up the good work.
Yeah. Well, thank you for coming today.
You're welcome. I'm glad to be here.
Well, thank you for watching Focus on Hope, and we hope to see you next time.